I want my audience to know that Dr. Jade Miller is president of the American Academy of Pediatric Dentistry, the chairman of the Nevada State Board of Health, and an expert in multiple additional aspects of dentistry. So we're very pleased to be talking to an expert on dental health and children's health and little teeth and how to keep them healthy. So again, hello, Dr. Miller.
Hello, Dr. Goodwin, and thank you so much for having me. I think I'm going to be able to share with your audience a variety of things that we hope will find valuable for oral health for kids.
Okay, that's very good. Now, why don't we just start there, and you tell me or tell us what you think are the key things that we need to focus on in terms of oral health for kids.
I'd be happy to, and I think it boils down to a few key elements. One is start early, and the American Academy of Pediatric Dentistry, as well as all other pediatric health organizations, recommend by age 1 your child should see a dentist, and my preference would be a pediatric dentist. Usually at age 1, the child has very few dental problems. That's what we want. We really want to start out as effective as we can preventively. And also take that opportunity more than anything to educate parents about how to really maintain good preventive oral health with a lifetime of good oral health for that child. So that's, I think, one of the more important factors. The other things to be aware of is daily oral hygiene. There was an ad council had a campaign, they call it 2Min2X. What that stands for is 2 minutes twice a day.
Okay, slow down, let's get that. The ad council, you say?
The ad council.
Had a campaign on, and it was called what?
2Min2X, 2 minutes 2 times.
2 min, 2 apps, which is twice a day? 2 minutes twice a day?
Yeah, and it really was an acronym for brushing for 2 minutes twice a day, that getting that message out to really parents and kids.
Okay. All right, so is that campaign still going, or is it over?
Now, you'll see it on radio spots, television spots, and billboard spots. So it's still an active campaign.
That's excellent to know. By the way, I don't want us to forget to say that this is National Children's Dental Health Month.
Yes, it is.
Okay, we want to be sure our audience knows that, and so this is a good time to focus especially on children's dental health, correct?
That is exactly right.
Now, there's a new way of handling or preventing or treating children's dental cavities. Could you discuss that?
You bet. About 18 months ago, what became available in the United States, which was available outside the U.S. for a period of time prior to that, but utilizing an antibacterial liquid that we apply to early cavities on teeth. And what it does is it kills the cavity-causing bacteria and stops the progress of that cavity. Now, I think it's important to understand this is not a panacea. It's not for permanent treatment for a cavity, but it really allows us in certain circumstances when maybe I have a very young child that really is not at that level from a cooperation perspective to allow me to treat those dental problems, to really buy time by stopping the progress of the cavity. That will then allow me to go back at a later time to more permanently treat the cavity.
I see. So how early in other words, you make an early diagnosis.
Right.
And then you apply this antibiotic liquid?
Yeah, it's an antibacterial liquid. Yep.
Okay. And then about how much later do you go in to do definitive treatment?
A lot of that is kind of dependent on that age and cooperation level of the child, and if we see we've been able to stabilize their cavity progression. So that's what we're really looking at. And sometimes it's a matter of, a year, 18 months, and then we're able to go in, as long as we stabilize things, allow us to go in and then treat them at a more opportune time.
I see. That's very interesting. And I think the other thing that we need to emphasize is that 1 in 3 children, 2 to 5 years of age, is affected with tooth decay. Is that correct? That's
correct, and isn't that an amazing but sad statistic that 1 in 3 of that age group child. As a matter of fact, it's one of the top chronic infectious diseases in kids in the U.S. today. So that's why I'm glad we're here to talk to your viewers.
Right. Yes. Well, that's important. Very important, in fact, and we're very appreciative that we're having this time to talk together. What causes so many children to have cavities?
There are a lot of factors that play a role in the cavity process, but some of the higher risk situations I'd like to touch on. One is in the very young child. That would be, infant and very young children, and that's a practice of putting the child to bed at night with a nursing bottle that has milk, formula, juice, basically anything other than water. At nighttime, they're not swallowing as much. The saliva flow is reduced, so the protective actions are not as effective. And the cavity process has a much higher opportunity to be at a higher risk at that time. The second aspect I'd like to talk about is more the teenage and young adult age group. With increased sports drinks and carbonated beverages being used, we see the effect, a double whammy effect, as I call it, where you get not only the sugars that have the negative cavity-causing impact, but also the acids in those beverages that really start dissolving and breaking down the tooth structure, making the problem even more severe. So those are the two biggies.
Go on. I'm sorry.
Yep, those are the two biggies. And
right.
Yeah.
Well, let me just ask you this: are you suggesting that it's probably not a good idea for mothers or parents to put young children to bed with a bottle?
That's correct. And from a dental perspective, what we would ask them to do is to feed them before they go to bed, have them consume as much of the nutritional substance that they can so they sleep longer through the night. These are infants. But really to avoid putting them to bed at night with a bottle. Now, if it's water in it, we're not going to see the concerns. But really, other than water, that's where we become concerns. And I see very young children with significant cavities that contribute best to this.
Okay. So those are two very important, I'll say, parental lessons.
Right.
Both in terms of limiting or avoiding the use of nutritional substances in bottles at bedtime, and also being aware that the sports drinks can be a problem. I started to say can be a problem, but they are a problem. Is that right?
They are, particularly if they're used, on and off all throughout the day or afternoon. They're going to consume them. I'd rather have them consume it at one time. And there's a lot of good information that I think your audience can go to with the AAPD's website called mychildrensteeth.org. I think that is really...
hold on. mychildrensteeth.org.
Yeah.
And that will take us to a lot more information that people can get.
Absolutely. Yeah. And so I invite your audience to go there, and I really appreciate you having me, Dr. Goodwin.
Yes, well, it was good talking to you, and I'm sure this information will prove helpful.
Okay, I hope so. Thank you so much.